health that has been making headlines today. Cancer patients and survivors now want the government to streamline the National Health Insurance Fund, NHIF, to cover their full medical care services in a bid to lessen the burden they are forced to bear of raising funds to seek treatment abroad, mostly in India. Now, the survivors spoke as they joined the world in marking World Cancer Survivors Day. It is a march of survivors walking the streets, singing songs of praise and appreciating the journey that saw them come out as victors. These are people that have survived cancer in the country. However, they have a cry. The cost of treating it is leaving them destitute. Their call: affordable healthcare. 4th June is a day marked to celebrate survivors for making it to the end of the tunnel of this dreaded disease that has left them broke as they are forced so deep into their pockets to fund for their medical expenses. Speaking as they marked World Cancer Survivors Day at Thiko Level 5 Hospital in Kiambu County, the survivors decried that they are compelled to do harambees to sustain their treatment journey.
The cancer 2011 na ile cancer niko naye inaitwa colon cancer. Tunatumia mabags. Hizi mabags, ile kitu inaumiza sisi ni is very expensive. Na huwezi nunua bag moja ni 1,200. So tunakuwa naomba serikali kama tunaweza simamia sisi watu wa cancer, kama wale wanatumia mabags, at least tupate mabags.
Ile shida kubwa tuko nayo ni kwamba NHIF haitusaidii kabisa katika diagnostics ya cancer. Yes, for now ni mzuri na tunashukuru wanatusaidia na chemotherapy na radiotherapy part. We are requesting, tafadhali, cancer is a very heavy financial burden. Tulipiwe cancer matibabu yote.
This comes amid revelations that Kenyans spend at least 10 billion every year to seek treatment abroad, mostly in India, for cancer and other non-communicable diseases. Currently, the NHIF cancer care package only entails up to 10 chemotherapy sessions, oral and injectable anti-cancer drugs, inpatient and outpatient oncology services, several sessions for radiotherapy, and up to 2 brachytherapy for advanced cancer annually.
The current agenda of the government is looking at primary prevention. Okay, so we are hopeful that as we are putting more efforts towards prevention and early screening, we will be able to reverse so that patients come early and even the cost of care to NHIF is reduced. So the late stage is not really very effective because of the high costs, and that's why we are putting efforts on screening and early diagnosis so that the costs come down, so that even as NHIF, they are able not to be able to sustain the costs.
People have, however, been called upon to embrace early screening for easier management.
We really emphasize on a lot of early screening, because once the disease has been found in early stages, it is not as expensive as it is when you are treating a stage 4 disease.
The government has plans to put up a cancer care center in the country, even as the local governments, through the available hospitals, continue to offer screening and other cancer treatment services.
As a county, we are at the moment in discussion with a partner who is going to help us set up a center of excellence on oncology in Thika Level 5.
So it's none other than Peter Whiter, who is with us here. He can give us a speech.
Now, it's going to put us down.
All right, now away from that.